Good morning, everyone. This is Group 9, and we are here to present mobile memory clinics in association with the university. This is ideated by Amanda, Ruben, and myself, Andrew. Our design challenge is reimagine the diagnosed experience with a dementia patient. Georgia, the 70-year-old woman, she's in the middle stage of dementia. And also the Anastasia and Joseph is the two kids of her. And in terms of context, the family is immigrants and they have relatively low income, so they don't have the family doctor and they don't have too much knowledge about dementia. Right now, Georgia's home care brings out the Anastasia and Joseph, and they are looking forward to find a treatment for this disease. Now, Amanda going to talk detail about the current situation the family faced with.
So what's happening right now is that Georgia has been acting strangely. So she is forgetting things and saying something that has no sense. And Joseph is worried about this. So he decided to take her to the emergency room because they don't have a family doctor. So they went there, they got an appointment, and the doctor ran some tests, but he was not a specialist in dementia, but he diagnosed Georgia with dementia, and he gave them some information, some of the next steps they should do. But then there was so much information that they just forgot and they couldn't get the care that Georgia needed. So 1 week later, they went to the emergency room again, trying to get some more information, but this time the doctor wasn't there. There was another doctor and they had to tell the whole story again and they couldn't get the right information. So that's what's happening with them. And the key insights we took from it was that patients who do not have a family doctor have to figure out their way into the health system without much help. And families struggle a lot looking after their loved ones and keeping them as cared as they deserve to be. Patients need to seek care as early as possible before the disease is in advanced stage. So this is why they need information as soon as possible. And effective communication between professionals such as doctors and nurses and the caregivers, family caregivers, is key. So now Ruben will talk about the reimagined experience.
So looking at the reimagined experience, with this idea, we try to create an interconnected loop between the patients and their families. Working in tandem with universities, this is a way to bring extra care and extra bodies to the patients that would need it in low-income neighborhoods, as mentioned by Andrew. And with this, the mobile memory clinics will be using public resources, such as churches, parks, apartment buildings, and meetings, in order to hand out leaflets, in order to educate people about the potential symptoms of a disease that is dementia, if they are not aware of the problems that are happening within their family. Next, they will be provided with a lifeline, such as a phone number, which is where Anastasia was at one of these meetings, and notice some of the similarities between those symptoms and what were happening in Georgia. She then called the mobile memory clinic, and with this, you would be able to get a first and initial diagnosis within that visit. That visit would then be ended with affirmative diagnosis of dementia, and then we'll be given a booklet in order to have the additional information that is required in terms of symptoms and what to do. For the second visit, the professional or the nurse would be able to show you some of these steps in order to taking care of the patient for one day, so you could remember as to what to do for the next time and might not necessarily need that help again. Most of these steps will be undertaken through the treatment of either pet therapy or cognitive exercises. Pet therapy in order to keep them a bit more relaxed, and cognitive exercises in order to keep them more stimulated. With this, the patients and the families, mainly the families in this case, as usually burnout is the case for a lot of these families, they'll be able to get that rest and relaxation that they need and will be able to feel at ease with more of this disease that has been taking their loved one's mental state. We have now reached the end of the presentation. We thank you for your attention. And if you do have any questions, please feel free to ask them.